Hello students, today we will talk about the peritoneal fold. What is peritoneal fold? Peritoneal folds are the folds of the peritoneum, as the name suggests, and this suspends the organ to the posterior abdominal wall. So, they suspend the invaginated organ and perform the two functions. इसके दो function है. पहला, it provide the mobility to the viscera, first mobility, and provide passage for the nerve, vessels, and the lymphatics. Means only those organs which are being suspended by the peritoneum will be mobile in the abdominal organ, in the abdomen, and those organs which are not being suspended by the peritoneal folds, they will not be mobile. So we have got it has, and it will allow the passage of two organs. We have this one. Draw the these are like this. This is one structure, and this circle. We have got the organ over here. We have got the organ over here, and this one is the visceral peritoneum, and this one is the parietal peritoneum. And through this, all the structures, the artery, the nerve, and the vessels will pass. This is the organ where we have got the visceral peritoneum. Here we have got the parietal peritoneum, and this will allow the passage of the artery, veins, and the nerve. And we have got the two sorts of organ. One is the retroperitoneal, and other is subperitoneal. As the name suggests, any organ in the abdominal cavity. This one is the abdominal cavity over here. So we have got organ over here, and we have got the organ over here. We have got organ over here. Take a diagram over here. So we have got the organ over here, and we have got organ over here. And if this is the peritoneum, so we have got those organs which are lying on the posterior wall. These are the retroperitoneal. And those organs which are in the pelvic region, these are considered as the subperitoneal structure. They are considered as the subperitoneal structure. Now, embryologically, the retroperitoneal organs are divided into two groups. Retroperitoneal organs will be divided into two. One which is the primary retroperitoneal, and other which are secondary retroperitoneal. Primary retroperitoneal means they will be retroperitoneal since the birth, and the secondary retroperitoneal organ will be those organs which are initially in the peritoneal organ, and the due course of time, by the process of this zygosis, which means the absorption of the mesentery. Mesentery is being absorbed over there, and they become the retroperitoneal organ. So the primary retroperitoneal organs are the kidney, the suprarenal gland, and the ureter. So these are the primary retroperitoneal organ. Of course, we could take the name of duodenum also, but since it's proximal 2.5 centimeter is peritoneal, so it is not exclusively the retroperitoneal organ. So kidney, suprarenal gland, and the ureter, these are exclusively the primary retroperitoneal organs, and those organs where the peritoneal folds, the mesentery is being absorbed. This is the visceral peritoneum. We have got the parietal peritoneum over here. So, and this one is the body wall. This one is the body wall. So what happens over there? if this sort of a structure, this mesentery is being absorbed, this mesentery is being absorbed. So this, it has got only one covering. This is, it has got only one covering over here. It hasn't got any. This here we have got the organ. Then we have got the organ. This is the organ. So this organ, here we have got the organ, and this is the only one, the visceral peritoneum they have. They do not have the parietal peritoneum due to absorption by the process of zygosis. So this zygotic process is the body wall. Here we have got the organ. Organ is situated over here. This is the visceral peritoneum. This is the parietal peritoneum. And this is the artery, vein, and nerve which is coming over here. And this one is the body wall. This one is the body wall. Here we have got this is the parietal peritoneum. This is the parietal peritoneum. This is the parietal peritoneum. And this parietal peritoneum, and here we have got the mesentery. This one is the mesentery. So if this is being absorbed, means the parietal peritoneum is being absorbed, and it will get only the visceral peritoneum. So it becomes the retroperitoneal organ. So now the folds of the peritoneum could be classified by their work and where they are situated. Means if it is in the small intestine, it will be called mesentery. Omentum, we have got the greater and the lesser omentum around the stomach, and the peritoneal folds, peritoneal ligaments is also over there. So we have got the mesentery in the small intestine. We have got the mesocolon, as the name suggests, colon. So in the colon region, we have got the omentum in the small, and we have got the greater omentum, and we have got the lesser omentum. So greater omentum connects the stomach with the transverse colon, and lesser omentum connects the stomach to the liver. So both the omentum is meant for the stomach, and it will connect the liver to the. Can we could see over here? This is the lesser omentum, and it is connecting. This is the stomach, and this is liver. The stomach and this is liver, and it is connecting the stomach to the liver. It is connecting the stomach to the liver, and here we have got this one is the greater colon, and it is connecting what? It is connecting the colon. It is connecting the colon. Here we have got the colon over here. So greater omentum connects the stomach to the colon, and the lesser omentum connects the liver to the stomach. We have got the peritoneal ligaments. The peritoneal ligaments are, one is the coronary ligament, and this will connect the liver to the diaphragm. Liver is connected to the diaphragm over here. This one is the diaphragm. This is the diaphragm, and liver is connected over here. So this one is the coronary ligament. This is the coronary ligament. The coronary ligament. Then we have got the lienorenal ligament, connects the kidney with the spleen. We don't have the spleen over here, so kidney will connected to the spleen by this one, and the gastrosplenic ligament, the liver, the stomach is being connected with the spleen over there by means of the VAs, gastrosplenic ligament. Then we could see the developmental fold of the initial stage, that the gastrointestinal tract developed from the primitive gut that is divided into the foregut, the midgut, and the caudal hindgut. So we have got, this is the cranial end, this one is the foregut, this one is the midgut. Up to this we have got the foregut, and here we have, up to this we have got the midgut, and below that we have got the hindgut. This one is the foregut region, and this one is the midgut region, and here we have got the hindgut region. This one is the vitreointestinal duct. You see the vitreointestinal duct through which everything is going. This is the allantois. The urinary bladder is opening through this, and all the blood vessels will connect to this duct with the placenta. This is being divided into two regions. If you would take this like this, so we have got this. If this is ventral and we have got in the cranial region, we have got the development of the stomach over here. In the foregut region, we have got the stomach. So stomach developed in the foregut region. So this divide this into the ventral and the dorsal. In the ventral region, we have got the development of the liver over here. The liver is being developed over here. So with the development of the liver, this ventral region is divided into two regions. One in front of the stomach and one in the front of the liver. So this zone is actually the zone of the lesser omentum. Here develops the lesser omentum. Here develops the lesser omentum. The zone of the lesser omentum. And liver, and here we have got the coronary ligament over here. Liver is connected to the anterior abdominal wall by means of the coronary ligament. Coronary ligament. At the top, we have got the development of spleen over the diaphragm over here. This is the diaphragm. This is diaphragm. And at this point, we have got the development of spleen over here. We have got the spleen over here. So posteriorly, the spleen is connected to the liver. The spleen is connected to the stomach by means of the gastrosplenic ligament. Gastrosplenic ligament. Gastrosplenic ligament connects the liver, the stomach to the spleen. The spleen is connected to the kidney over here. This is lienorenal ligament over here. So lienorenal ligament will be over there. And the liver is connected to the diaphragm by means of this one is the coronary ligament. This will be the coronary ligament. Liver will be connected to the diaphragm by means of the coronary ligament. In the fourth and distal part of the dorsal mesogastrium. This is called the ventral mesogastrium. This is called the dorsal mesogastrium. Distal part of the dorsal mesogastrium will give the attachment of the greater omentum. Greater omentum will be developed here. In the foregut region and in the midgut and the hindgut region, we don't have the ventral, we have only the dorsal mesogastrium over here. We are not concerned with, at this point, with the midgut and the hindgut. We will focus only on the foregut. So foregut region is, first there is development of the stomach. After that, there is development of the liver. With the development of the stomach, the foregut region is divided into the ventral mesogastrium and the dorsal mesogastrium. Ventral mesogastrium, we have got the development of the liver. The liver is connected to the stomach by means of the lesser omentum. The liver is connected to the anterior abdominal wall by means of the falciparum ligament. Falciparum ligament. And the liver is connected to the diaphragm by means of the coronary ligament. We will connect to the diaphragm by means of the coronary ligament. And in the distal part of the dorsal mesogastrium, we have got the development of the greater omentum. So here is the list of the structure which are being developed from the foregut, midgut, and hindgut. The source of this PPT is the Yogesh Vontake's book. So you could confirm with that book. So we have development of parts of the gut which are developed from the foregut is the floor of the mouth, the tongue, the pharynx, esophagus, stomach, proximal part of the duodenum up to duodenal papilla, pharyngeal pouches, liver, pancreas, gallbladder, and respiratory system. Meaning by what? Whenever we go to the blood supply of or the blood supply of this region, all of them will be supplied by the celiac trunk only. So we have to take care of this zone. Now next we have got the midgut region. Midgut region we have got the duodenum up to the major papilla we have already done. So distal to the duodenal papilla we have got the development jejunum, ileum, cecum, appendix and ascending colon, and transverse colon 2/3. After transverse colon, now we are left with the remaining 1/3 of the transverse colon, descending colon, sigmoid, rectum, upper part of the anal canal, and the mucosal lining of the bladder and the urethra. So this is the complete list of the parts of the parts which are being developed from the foregut, midgut, and the hindgut. So foregut is supplied by the celiac artery, the midgut is supplied by the mesenteric artery, and the hindgut is supplied by the mesenteric artery, the inferior mesenteric artery. So foregut region, we have got the abdominal dorsal aorta over here. You could see that this is the dorsal aorta, this is the dorsal aorta, this is the dorsal aorta, and from the dorsal aorta there is an artery called the celiac trunk. Then we have got the superior mesenteric artery, we have got the inferior mesenteric artery. This is the foregut region. Up to this, we have got the foregut region. So all the structure in the foregut region will be supplied by the celiac trunk. We have got the midgut region over here. Up to the transverse colon, 2/3 part, we have got the superior mesenteric artery will take care, and below that it will be the inferior mesenteric artery which will be taken care of. This is the umbilical. This is the Whitlow standard duct over here. This diagram you could see. This is the dorsal aorta. This is the dorsal aorta. And from here, we have got the celiac trunk going into the proximal foregut region. Then we have got the superior mesenteric artery. This is going into the midgut region. And we have got the inferior mesenteric artery. This is going into the hindgut region. And all the three are the branches of the dorsal aorta. So we have already discussed about that. We have got the abdominal aorta by two mesentery, the ventral mesogastrium and the dorsal mesogastrium. So the fold of peritoneum that connects the foregut with the anterior-abdominal wall under the surface of the diaphragm is the dorsal ventral mesogastrium, and the fold of the peritoneum connects the foregut with the posterior abdominal wall under the surface of diaphragm is known as the dorsal mesogastrium. Liver develop in the ventral mesogastrium and divide the ventral mesogastrium into the falciform ligament and the lesser omentum. We have already discussed. And with the development of the spleen, the dorsal mesogastrium forms the gastrosplenic ligament. We have already discussed gastrosplenic ligament. Linorenal ligament, we have discussed, and the gastrophrenic ligament that connects the stomach with the diaphragm. Now we have got the greater omentum. This greater omentum is the expanded caudal portion of the dorsal mesogastrium, which we have already discussed about that. And the midgut and hindgut region have only the dorsal mesogastrium. And due to the rotation and of the gut and zygosis, the dorsal mesogastrium of some part of the gut also get absorbed. Remaining dorsal mesogastrium, they forms the mesentery of the jejunum and the ileum, the meso appendix, the transverse mesocolon, and sigmoid mesocolon. In the foregut region, we have got both the dorsal and the ventral mesogastrium. But in the midgut and the hindgut region, we do not have the ventral mesogastrium. We have only the dorsal mesogastrium. In that dorsal mesogastrium, in some part, it gets absorbed because we don't have the mesentery throughout. So only in that region where the mesentery persists, we have the fold of the mesentery, the peritoneum, or in form of mesentery over there. We have in the small intestine, we have got the mesentery. In the transverse colon, we have got transverse mesocolon. In the sigmoid colon, we have got the sigmoid mesocolon. In the appendix region, we have got the mesentery of the appendix, and so on. This diagram again, you could see that this one is the dorsal mesogastrium. This is the ventral mesogastrium. You could see the development of spleen over there. This is the liver, and this is the stomach. Foregut is the stomach. This is divided into the liver is being developed over here. This is the ventral mesogastrium. This is the dorsal mesogastrium over there. This is the midgut region, hindgut region, and we have got the mesentery over here. This is all the mesentery. This is all the mesentery over there. So spleen is developed in the dorsal mesogastrium, and liver in the ventral mesogastrium. So here we have got the liver. This is the liver. This is the liver over here in the ventral mesogastrium. Liver over there, and this is the stomach. The foregut. The derivative of the foregut is first is stomach. So we have got the stomach over here. So this stomach has divided into the foregut is divided into the part between the anteabdominal wall and liver, and part between liver and the stomach. So this part between the liver and the stomach, we have got the development of the falciparum ligament. This is the falciparum ligament over there. And the part between liver and the stomach, here we have the development of the lesser omentum over there. We have got the development of spleen in the dorsal mesogastrium, spleen over there. So we have only the gastrosplenic ligament connecting this one, gastrosplenic. And we have got the linorenal ligament which connects this to the kidney. And in the dorsal part, we have got the development of greater omentum. In the distal part of the dorsal mesogastrium, we have got the development of the greater omentum. You see in this diagram that week 11, what are that? The liver is again over here. Liver is again over here, and we have got the development of the spleen over here. The stomach over here, part of the foregut region, and we have got the spleen over here. This is the plane of section. If this section is being removed, what structure we could see over here? So this one is the right side. This is the right side, and this is the left side. This is left side. We have got the right side and the left side. This is the dorsal region. This is the ventral region. Dorsal region, you could identify that because we have got the kidney over here, we have got the aorta over here, and we have got the inferior vena cava over here. So these are all the dorsal part. Next, we have got we could identify the spleen over here. We have got the spleen over here, and we have got the stomach over here. On the right side, we have got the here we have got the gastrosplenic ligament connecting the liver, the spleen to the stomach, and this one is the linorenal ligament connecting the spleen to the kidney. Spleen is connected to the kidney by this one. Spleen is connected to the kidney by means of this linorenal ligament, where we have got the linorenal ligament over here. We have got this is the spleen and this is kidney. So its kidney is connected to the spleen by means of this linorenal ligament, the posterior half, and this is the anterior half. And here we have got the lesser one. This is the right side. So we have got the liver over here. This is the liver. And so this is being connected to the stomach by means of this lesser omentum. Connected to the liver by means of this lesser omentum. This is the lesser omentum. Over here. And the lesser omentum will continue up to the liver. And this will create the sac, and this will become the lesser sac. We'll talk about this later on. So week 11, you could see in this diagram that we have got the stomach over here, we have got the stomach over here, we have got the liver over here. This is the ventral mesogastrium, and this is the dorsal mesogastrium. We have got the dorsal half, this one, this is the ventral half. We have got the stomach over here, we have got the liver over here. Here we have got the falciparum ligament, here we have got the gastrosplenic ligament, and here we have got the kidney, so we have got the linorenal ligament also. So Now this will rotate. If this will rotate to the right side, so you see the lever is coming over here. Then you have got the, at this point we have got the development of the lesser momentum. Here we have got the falciform ligament. Here is the spleen, and here is the liноrenal ligament. Here is the linorenal ligament. Everything is clear over here. This is the liver. This is the stomach. This is spleen. This is kidney, and here we have got the this beautiful the linorenal ligament over here. This is the linorenal ligament over here. This is the linorenal ligament over here. So tomorrow we will talk about the greater momentum. Thank you.